Hi there, welcome back to the Vision by Design YouTube channel. My name is Trevor, and today we're talking with Dr. Sarah Keep. She is a vision therapy optometrist, and she is the one who's going to be talking today and sharing some information about your eyes and the coronavirus and what you need to know. I think right now is the perfect time to be sharing some information about that. So why don't you go ahead and give us some stats and facts about your eyes and coronavirus?
Absolutely. So there's a ton of information out there about the coronavirus. I know it's challenging to go through all of it and kind of weed out what's fact and what's fiction. So I wanted to present some information based on some actual, evidence-based studies and stuff like that regarding the coronavirus and your eyes.
Sure.
And what you can do to prevent complications.
Okay, so first question that people might have is, how is the coronavirus transmitted?
For sure. I think we all know by now the coronavirus spreads through respiratory droplets. So these are droplets that are transmitted from person-to-person contact, most frequently after a person who's infected coughs or sneezes. So the virus can also live, we're thinking, on surfaces. So we still don't really know for how long and to what extent that contributes to transmission. But if you touch a contaminated surface, then you touch, your eyes, your mouth, or your nose, you could also infect yourself that way as well.
All right. Now, tell us, how does the coronavirus affect the eyes?
Yeah, that's a great question. So we all know that the coronavirus can cause a number of different symptoms, including respiratory symptoms, but it can also cause ocular symptoms. Conjunctivitis, or a red eye, is actually an early sign of a corona infection. So luckily, this infection is typically mild, and it only lasts and it only occurs in less than 3% of patients who are affected by the coronavirus. However, but due to this, it is possible to contract the virus from aerosol droplets if they make contact with your eye.
Okay. The next question that people might have is, does this mean that I should stop wearing contact lenses?
Yeah, that's a good question. So I know a lot of patients have been concerned about whether or not they should be wearing contact lenses because of this information. And there have been reports in media that you should avoid contact lens use. But this is actually unnecessary. So in fact, spectacle lens wearers, or people who wear glasses, they actually touch their face more frequently. And this would actually put you at a greater risk of catching the coronavirus versus a contact lens patient. So switching from contact lenses to glasses, it might also give people a false sense of security, which again could increase their risk. So there's actually no evidence that there's an increased risk of contracting the coronavirus for patients who wear contact lenses. And there's also no evidence that glasses offer any sort of protection either.
Okay, that's good to know.
Yeah.
What can I do to ensure I continue with healthy contact lens wear during the pandemic?
Yeah, that's a great question. So the same good hygiene habits that you should be practicing all along are still recommended. So doing good hand hygiene, we've all heard this, you need to wash your hands. So before you insert or remove your contact lenses, you should be washing your hands with soap and water. That way, if you did come into contact with a contaminated surface and there's, viral particles on your hand, you're not touching your eye and, inserting those into your eye. Patients should also ensure that their contact lens case is clean. So I know this is something, I've seen some pretty gross contact lens cases out there. You're supposed to clean your contact lens cases.
Yeah.
So make sure that you're cleaning them and replacing them frequently as well. Another good thing to remember is that it can be more challenging to get eye care nowadays. I mean, we're open now. I know a lot of offices are running at lower capacity just because we've had to expand our exam times and stuff like that. So it's even more critical to practice really good hygiene because it might be more challenging to get in to get your eyes tested. We're recommending maybe considering eliminating overnight contact lens wear, just because that does put yourself at a greater risk of having a complication or getting an eye infection, or potentially switching solutions to a different solution containing hydrogen peroxide and stuff like that. But really the biggest thing is wash your hands, and you should be doing that all along. So take care of the contact lenses the way that they're recommended, and then they shouldn't be a problem during the coronavirus.
Yeah, so if you were doing your procedures for putting your contact lenses in and out before, with washing your hands, making things nice and clean, then you should be okay.
Absolutely.
If not, start doing it.
Yeah.
So what should somebody do if they do contract the virus?
Yeah, that's a great question. So obviously contact, health ink and stuff like that. But as far as contact lenses go, discontinue the contact lens wear if you're sick. So if you have any sort of infection, whether it's a cold or anything like that, you should not be wearing contact lenses. So again, that's a recommendation that stands even before the pandemic. If you get sick, discontinue your contact lens use. We would also recommend disposing of the contact lenses in the case and stuff like that were contaminated, just to prevent reinfection and stuff like that. Glasses would then be recommended to be worn until the patient is actually recovered, at which point then a fresh pair of contact lenses can be worn again.
All right, so how is one affected if they just have glasses and they don't have contact lenses?
Yeah, for sure. So that's a great question. So the important thing to remember is glasses don't protect you from the coronavirus. So you can still get respiratory droplets that come into contact with the surface of your eyes if you're wearing regular spectacle lenses. So unless you have droplet rated safety glasses, they actually don't provide enough of a barrier. And as discussed before, some patients might be misled to think that this is actually protective for them and put them at a greater risk because of that. So because when you have glasses on, it increases how frequently you actually touch your face and touch your glasses. So this could actually contaminate your glasses. So the virus, again, can last on the surfaces, the acrylic and the metal surfaces on your glasses, for a period of time. So we do just recommend that you wash your glasses and avoid touching them regularly to prevent them from getting contaminated.
Okay, so then what is the best procedure for cleaning your glasses?
Yeah, for sure. It's easy, just soap and water. So all you want to do is wash them in a soapy water solution and dry them with a clean cloth. That's the most effective way to clean them. You can then polish them afterwards the way you always would before, again, just using the regular anti-reflective cleaner and as well as like a little microfiber cloth. So, and again, regular hand washing is going to be the most important thing. So if you're touching your glasses, make sure you're washing your hands, and this will help to reduce the transmission of the virus while you're kind of touching stuff that's around your face.
All right, Dr. Sarah. Now, what should somebody do if they need to get their eyes examined right now?
Yeah, so we're officially open now, which is great. So we've been given the go-ahead from the beginning of May to be able to open again for patient care. As I said, patient care looks a little bit different now than what it did before. So exam times are extended in a lot of clinics now. It takes some time to sanitize properly between patients. So that might make it a little bit more challenging to get an eye exam just because we can't see the same patient volume. And we're doing certain disinfecting procedures and stuff like that. So we're taking appointments by appointment only. So you do have to contact the office rather than coming in and stopping by, as a walk-in as we previously were able to do. And then we do request that patients are wearing masks and stuff like that when they come into the clinic as well. So things look a little bit differently, but we're able to still offer the same great care. So if you need anything, then don't hesitate to give the office a call. There's lots of availability to come in and get your eyes tested.
Right. So be patient and be prepared for a little bit longer of a time spent at Vision by Design Optometry with Dr. Sarah. Now, what if somebody runs out of contact lenses? What can they do?
For sure. So we can actually direct ship contact lenses to your house. So we've spent some time during the pandemic to make it even easier to order contact lenses. So you can now just text us or email us with the click of a button. We can fill your contact lens order. On our end, we can take care of all of the direct billing and stuff like that, and then direct ship them directly to your house. So if you just need to update a contact lens prescription, it's easier than ever now. If you need a contact lens exam, just give the office a call. Again, we have to book appointments to be seen in the office. It is by appointment only, but we have lots of spots available to come in and do an appointment if you do require contact lenses.
That's really handy for your patients to be able to order contact lenses right with the click of a button.
Absolutely.
Now, what if somebody needs new glasses? What's the procedure for that?
So again, it's a little bit different. We're disinfecting stuff in between patients because obviously if you try glasses on and they're in such close contact with your eyes, we wouldn't want another patient to then come and try those glasses on as well, just in case there's a risk of infection. So the only thing that really has changed is patients have to book appointments so that they can have the assistance of one of our staff members, which honestly is a great thing because they're great at picking frames out. So But other than that, it's pretty much the same as what it was before. So you can come in and try on glasses and contact lenses, glasses and sunglasses and stuff like that. And now you have more of a hands-on experience and stuff like that with one of our staff who are really well trained in making sure the glasses look wonderful on you. So
yeah, and that's better. I've been to some optometry clinics, and there's not a lot of help with selecting lenses or selecting frames rather, and making sure that you look good. You're just kind of left to your own devices, and then you come back with a sampling. But it'd be better, wouldn't it be better to have somebody who's there to help you pick out frames, who has some experience with face shapes and skin tones and eye colors and all that stuff, which these guys are great at. So I think you should definitely make an appointment to come see Dr. Sarah Keep and their staff. Now, the last question is frontline worker. Say I'm a frontline worker. What can I do? Can I get some safety glasses? What's the procedure for that?
Yeah, for sure. So we've had a lot of questions about safety glasses in the office. And as I mentioned before, just a regular pair of safety glasses doesn't necessarily protect you depending on the work environment that you're in. So we actually did bring in some droplet rated safety glasses where they actually are completely sealed. We can make them with prescription lenses and stuff like that as well. So if you are a frontline worker or another healthcare worker where you work in an environment where there is a greater chance of contamination, and that's something that you require for work, we're happy to help you with droplet rated safety glasses as well.
Perfect. Well, thank you so much, Dr. Sarah. And again, thank you for joining us on this YouTube channel here, Vision by Design. And if you are in need of contact lenses, glasses, or safety glasses, you can definitely contact Vision by Design Optometry in Edmonton. You can check them out on the website, visionbydesignoptometry.com, and it'll be able to help you out and get you in to see a doctor and get that prescription out to you as soon as possible. Thank you so much. Stay safe, and we'll see you next time.